How I met Dr. Kaplan was coming for an interview for a position here as RN, and just working with him over the first year and watching him do surgeries, I realised that he was someone that was confident, he was talented, and that I was impressed with his work. And after spending a year with him, realising that this is the kind of person that I want to be doing work on me. After I realised that, looking at myself in the mirror, I could see that I was looking tired, and people were actually making comments to me about how tired I looked, and was I tired when I was not tired. And I just realised that the way I was feeling, I was not showing in my face. So I realised it was time to make the face match the way I felt, get rid of the tired look, and I would feel better about myself. So that was my decision on doing the surgery. Instantly saw the result within the first couple of days. I had very little discomfort, very little swelling, and the biggest thing for me was my tired eyes, and instantly they were gone. And I saw improvement within probably up to 3 or 4 months afterwards. Being in nursing since 1975, you come across a lot of surgeons and with a lot of personalities. The one thing that I like about Dr. Kaplan, he's easy. He's not your typical surgeon. He's not intimidating. He's relaxed. You know, working here it's a fun environment. You know, he's just enjoyable to work with. He enjoys his job. You can see that come through it. He doesn't make you ever feel like he's in a hurry and it's inconvenient or whatever. He just is relaxing to be around. He listens to what you want to have done, and he listens to the problems that you're seeing that you want to have fixed. The patients here are very happy with him because he spends the time with them and he does listen. And I see patients come and go very happy. At the length of the surgeries, they kept to just the amount of time that needs to be done. It's easy by the time we finish the surgeries with them. By the time they leave this office, they're up, walking out the door, feeling fine. My experience with the patient is by the time I see the patient is the first day of surgery, when they come to surgery. I find the patients that I have are ready, they've been educated, they're comfortable. Then my position afterwards is spending time with them in the operating room, and then they come back to me into recovery. And I spend the next hour or so with the patient in recovery, getting them prepared to leave the office. You know, as a nurse, I've been with lots of surgeons. Some I would not let them anywhere near me, but watching Dr. Kaplan with his surgery for the first year, I decided he was the person that was going to do surgery on my face. The sight of being a patient and a surgical nurse, for me, this was the person. The one thing I can say about Dr. Kaplan is the day I came for the interview for surgery, I was not terribly serious about getting the job. And I'd say that 90% of the reason I took the job was meeting Dr. Kaplan and realising how comfortable I felt with him. And he was someone that I really wanted to work with.